Clarify though.
Are we gonna pretend like I'm a 3 and you're my mommy, telling me how to talk?
Wow. Okay.
Okay.
Oh, damn, that was pretty aggressive.
For example. Okay.
That doesn't make any sense to me. I don't think that food makes very much sense to me in my neurodivergent brain.
This is where mechanistic eating actually helps people who are neuro.
What is that? Food doesn't make sense to me because I have autism. What does that mean? We're watching all of this. Check a little bit out though. Hold on.
It should be against the law to discriminate against people based on their body size.
Unquestionably.
So why don't we see more fitness and wellness advocates asking for that?
I'm happy to ask for it. Ask for it right now. I didn't know that you thought I wasn't for it.
I wasn't allowed to have a ding dong. When I came home and I said, I want ding dongs in my lunch. You know what my mom bought me? Low fat ding dongs. Maybe there's more to life than trying to lose weight. That's what body positivity has given me.
You have to love yourself. You have to invite love into the space.
How?
By looking at yourself in the mirror and telling yourself, I'm beautiful.
It's not gonna work, kid.
It does
That's
work.
an SNL skit.
Are Americans fat phobic and obsessed with unrealistic beauty standards, or has the body positivity movement normalized unhealthy habits and lifestyles? I'm John Regalato, and today we're gonna have a debate about what it means to be healthy. Jillian, how are you feeling?
Feel good.
Debaters, you ready to come at Jillian with your best arguments? All right, let's get into it.
Hi, I'm Jillian Michaels. I'm a fitness expert and a health advocate, and today I am surrounded by 20 body positivity activists. All right, my first surrounded claim is that obesity is not healthy, and pretending it is puts lives at risk.
Are people gonna fight on this? Oh God. Oh boy.
If you want to be the first debater, get to the chair in 3, 2, 1.
Hi. I'm Edie. Nice to meet you. I'm an eating disorder therapist. I'm going to do my best to not use the O word because I find it pretty offensive. So I'm going to use fat-bodied.
Jubilee knows what they're doing, okay? They know what they're doing. They know what they're doing.
As we talk.
Okay.
Do you understand why people find it harmful and triggering?
Overweight and obese is literally just having too much body fat. It has nothing to do with the quality of the person.
Yeah, I agree with you on that.
Are we going to debate the claim?
Yeah,
Or
I just
are
wanted
we
to.
Gonna,
Yeah, I wanted to clarify though. The
are we going to
language.
pretend like I'm a 3 and you're my mommy, telling me how to talk?
Wow. Okay.
Okay.
Oh, damn, that was pretty aggressive. But that was unnecessarily aggressive. But okay, let's go.
So the claim that you're saying is that it is inherently unhealthy to live in a fat body.
It's inherently unhealthy to have excess body fat, yes.
Okay. Where are you getting that information?
Oh, okay. There are dozens of MRT trials
my
that show having
God.
excess body fat. Dozens is causal, not correlated.
No, that's not true. There's no disease that just fat-bodied people get.
I didn't say that. I didn't say that. But obesity lends itself to all-cause mortality across the board. Have you heard of something called adiposopathy? Mm-hmm. Okay, so you know it means literally sick fat. And you understand how it works? Mm-hmm. Okay, tell me how it works.
So it's additional layer of fat in the stomach area.
No, that's not what it is. It works as follows. When we eat too much food,
Adiposity. Isn't adipose tissue just all fat? Isn't that just fat tissue? Okay.
that has energy that we're not utilizing. The body needs to put that energy somewhere, right? So it puts it in fat cells. So it puts it in initially subcutaneous fat cells, a little bit of visceral fat, which is fat around the organs. And at first you have hyperplasia, which means we're recruiting new little fat cells, which isn't necessarily a bad thing up to a point. Now the issue is that once—
Oh, I've never heard of this term. Adiposopathy. Adiposopathy or sick fat refers to dysfunctional fat tissue that contributes to metabolic disease. It is not simply excess body fat, but fat that has become biologically altered in ways that promote inflammation in some— Oh, I've never heard of this before. Okay.
you can no longer recruit more fat cells, right? You get hypertrophy. So the fat cells start to expand. And this is exceptionally dangerous because what ends up happening is the blood vessels get outpaced. So the fat cells can't get oxygen and they start screaming, literally. And when they do, they release cytokines, inflammatory proteins, right?
I want to pause.
Of course you do. I want to pause. Because it's irrefutable.
Damn, she's so aggressive. Is this a person that I would hate in any other context, but I'm going to side with her here because all of these women are fucking insane?
You don't even know what I'm talking about. So
Jillian, okay, first of all, I don't appreciate the way that you're speaking to me. You called me out for just trying to understand the languaging and saying I was talking to a 3-year-old. I felt like I was talking to you very respectfully. You're talking to me very disrespectfully right now.
Here's the thing.
And
She was one of the hosts on The Biggest Loser. Okay.
You're telling me you understand it, but you don't understand it. You fundamentally didn't describe it accurately.
But what I understand is that
What's lipotoxicity?
I don't want to talk about, I am not, okay, here, I'm going to say this straight out. I am not a medical doctor, okay? So I'm not going to talk to you about medical diagnosis because that's outside my scope. And I'm
She's called you evil in the past. Well, then fuck this woman. Oh, she's the same girl that was beefing with Anna Kasparian. Oh, on that show.
fully willing, hey, I'm fully willing to be wrong. What I am here to talk to you about is the fact that people in fat bodies are irreparably harmed going into the medical system every single day because of the term, the O word.
So that's what you want to litigate?
Yeah.
Okay, that's not the claim.
I think most people have abandoned this like people first language paradigm. Like I don't think people think it actually helps anymore. Like you're not a sick person, you're a person with sickness. Or the most common example would be like you're not a homeless person, you're someone who's unhoused or whatever. I feel like people don't push this point as much anymore. It's kind of stupid.
The idea that fat-bodied people are inherently unhealthy is, I believe, incorrect.
You're wrong.
No, I'm not
There's a
wrong.
robust amount of data.
If you want to be super technical, people who are fat are not inherently unhealthy, but the fatness aspect of you is an inherently unhealthy aspect. It's kind of weird to say if a whole person is healthy or unhealthy. There's a million different ways you can measure that, but like all else equal, you would be better off not being obese.
I'm not wrong.
Okay, so let me finish the
You
thought.
can't look at.
And let me finish the
Let me
thought.
finish my thought first,
Okay,
please.
sure.
You can't look at a person's body and tell whether or not tell their health status.
So fat is an endocrine organ. When it overgrows,
Oh God, she's going to be super, oh boy.
it does wreak havoc in the body. I didn't finish telling you what happens. So when the oxygen can't get to those fat cells, they'll die and they'll rupture. And then the immune system starts dumping macrophages in to try to clean it up.
But do you know what's
But they
even more
can't clean it
unhealthy
up.
is weight cycling. And as we talked about earlier, only except for your
That is
your
not
people who
the claim. If you want to talk about that claim, we can. The claim is.
So then what are
that
you supposed
having
to do though? So let's say this person is in a fat body and they are inherently unhealthy, right? We're telling they're unhealthy because they're in this
the
fat
vast
body.
majority
What are
of
they supposed to
people Will
do?
be more,
Lose weight?
significantly more prone to all-cause mortality. For me,
Intentional weight loss fails 95 to 98% of the time.
Find a way to make it better.
So what is the,
Pump them up with that, get them on the Aussie train, baby.
either you would probably know this better than me.
because weight is not an individualistic pursuit. You narrow it down to this idea that it's causal, like that they're just not trying hard enough. But
No,
that
I
is
didn't say that. It's multifactorial, unquestionably. A lot of people lose weight. The problem, right, is that they put it back on. Are we in agreement?
Yes.
Okay, great. Why do you think?
Okay, we got to pause there.
God damn it! All right.
I'm sorry.
Done. I'm getting somewhere.
Yeah, but you
All right.
voted out by the majority. Please return to your seat.
Why do they have the host on the camera now?
okay.
Hi.
I have lived in a fat body for like as long as I can remember.
What are you, like a Gundam pilot? Piloting my body over to the chair right now. What's worse, being super overweight or underweight? Probably worse being obese than being underweight. It's probably healthier being overweight than underweight. Depends on how underweight you are. Or it's better to be slightly overweight than slightly underweight. I think it's called the paradox of, there's some name for this, but like basically, I think as you get older and you get sick and stuff happens, you tend to lose a lot of weight. So having a little bit of extra fat gives you like, for some reason, I think they fare better on all-cause mortality if you're like a little bit overweight versus in the healthy range or underweight. But like there are other factors than just weight that determine your health level, right?
And I've known very many fat people. And I don't think any of us, the people that I know, I can only speak to the people that I know, I don't think any of us are pretending that we're okay with it. What I want to say here is I live with autoimmune disorders, I live with chronic illness, and I'm also neurodivergent. And this is...
Just give up then, Chief.
The body positivity movement has made it so that I can tolerate this life. I can find ways to thrive, even still. But I'm not pretending that this doesn't bother me. And by bother, I mean that it doesn't hurt to carry my weight. I'm willing to concede with you that carrying around extra weight is harder. It is. But it must be done.
I don't know that I agree with you.
Okay. Tell me more, please.
Well, tell me why you think it must be done.
Because I've worked really hard to not have this.
What does that mean? Like you beat yourself up in the gym or something?
No, I don't. That's not fun.
No, I'm not. I'm just trying to understand what you mean.
What I mean is that
what was that
because I've
question?
worked really hard to not have this.
What does that mean? Like you beat yourself up in the gym or something?
No, I don't. That's not fun.
No, I'm not. I'm just trying to understand what you mean.
What I mean is that I grew up with a number of undiagnosed conditions, and even I can think back to like middle school, and I couldn't keep up when the PE teacher would make us like run laps, and I'm like, this is physically aching me, and I didn't understand why. And I didn't understand why because I grew up with a single parent, undocumented single parent. We were bound to the medical system that we had access to.
I understand.
I've done what I needed to do a number of times to try to lose weight.
What did you try? Tell me.
I've I've worked out at the gym. I've tried to do Pilates. Even yoga. Okay. Even yoga hurts me.
Okay, so the exercise causes you pain.
The exercise
autoimmune
causes
condition.
me.
Okay, no problem.
Right.
I'm with you.
Dieting, for example.
Okay.
That doesn't make any sense to me. I don't think that food makes very much sense to me in my neurodivergent brain.
This is where mechanistic eating actually helps people who are neuro.
Why does that? Food doesn't make sense to me because I have autism. What does that mean?
Divergent, and the research supports that because it doesn't have to make sense to you.
Okay.
In other words, it's like you eat on these schedules and you eat these foods and you eat this much, hence the concept, right, of mechanistic.
I don't like that.
I understand that you don't like it, but you'll have to decide which you don't like more. Carrying the weight or the mechanistic eating, because it actually could be helpful. There are other ways forward, but you told me you tried them.
I tried a whole lot. There's a lot of other things to be concerned about. I'm also a social worker. I work with youth. There are a lot of...
Let's go back to you.
Yes.
Tell me-
I'm saying for me, right? There are many things that I'm more concerned about than my weight. My body is not the most interesting thing
You just
about
brought
me.
up your weight and said, I don't see a way out of this.
Right,
I've tried
and
everything.
I
telling
take
you
care
that-
of it in the ways that I can, and I've found works for me.
But you just told me it didn't work for you.
But it works to an extent.
You just told me it didn't work for you.
It works to an extent.
And this is an irrelevant conversation if you're happy with it.
I stand on 10 toes down, that we are not pretending that
But there's
this is
healthy
okay.
at any size. There are absolutely elements and aspects of the movement that do put that messaging into the universe. I've had those debates.
You've said?
I've had numerous
I want
debates with
to-
people who are body positivity activists that try to tell me that they can be healthy at any size. And it's just not the case.
And I disagree with that.
And I can do
Then
this
this
debate.
Then why are you
Use it
debating
as
the prompt? The prompt is obesity is not healthy and pretending it is puts lives at risk. Why would you come up here to debate this?
vehicle.
And I'm sorry, we have to pause. You've been voted out by the majority. Please return to your seat.
What I'm curious about is if you care about people's health and you have people in front of you, and I'm sure you have people online who are telling you that the body positivity movement, or I prefer body liberation, body justice, body acceptance, body blah, all the good shit that we like
She's taking
actually
notes.
increases their health, then I don't understand your debate. Like, what are you debating if the fat people are telling you it makes their life better?
I'm debating their physical health, and I'm debating the people who claim that you can be physically healthy at any size.
Okay, do you think you can be physically healthy and mentally unhealthy at the same time?
Of course, but that's not the claim.
Okay, sure. I think the part where I get stuck, I am a mental health professional. I work with people from a body liberation standpoint. I work with people in all shapes of bodies. What I know to be true from my experience is that body positivity, body liberation helps people take care of themselves. It's very difficult to understand why you think somebody is going to take better care of a body they hate. Like why body positivity would not inspire people to take better care of their bodies.
My argument. I never said you should hate your body. In fact,
No,
you
you
should.
didn't.
Okay, so I don't think that. What I think is that there are people in the movement
Yeah.
who have co-opted healthy at any size, and it went from access to healthcare
Okay.
to
Why does it feel like the internet has been overran with retards who want to have mental/physical illnesses? They almost always are commies too, and just a general extreme leftist archetype. You see it on Reddit every step now. It feels like they only recently have people even started to acknowledge they are extremists though. Well, because it gives you excuses for where you're at in life, right? If you have an illness or something concrete you can point to, then you have a reason why you're not where you want to be.
quite literally meaning for them that you can be healthy at any size, and that's not true.
Okay. I mean, the studies show that if you're very, 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 very thin or your body is very, 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 very big, it is more difficult to be healthy. That is absolutely
But
true.
then you agree with me on this point.
I don't, because I don't think body positivity is the dangerous thing. I think hatred of fat bodies and people hating themselves and people living in self-loathing because they've been taught that their body is the wrong shape, that's the danger.
Both can be true at once. So let's look at this, right? So the
Okay.
first thing we would want to do, obviously, is incentivize somebody. So it's like, okay, what's the why? That's going to allow you to tolerate the how. But hold on. That's the positive. That's the inspiration piece. Okay. Now, here's the issue. If that piece, if all the things that they get out of it don't serve them as much as the things they're getting out of being overweight, and it does provide quite a lot. I can give you an example.
Wait.
Then they're not going, unconsciously, they will sabotage the change. Can I give you an example so you'll understand it? Okay. There was a kid that I worked with.
Okay.
On Biggest Loser. He's 18 years old.
Okay.
He shows up with his dad, Ken. They both lose like 100 pounds. They go home, and they're visiting their family. It's the holidays. Doors fly open, and there's mom. And mom starts crying. And she's not crying tears of joy. She feels like they're going to abandon her, like they broke the contract, like they've outgrown her. And she becomes sad and she withdraws. So what does the 18-year-old do? He starts eating with mom again. What does the food provide him? A connection with his mom. That's something similar with my dad. This is one of the ways that we connected. Food provides a lot of people with a lot of different things.
Yes, you cannot eat and not have your parasympathetic nervous system turn on at the same time. There's no such thing as not emotional eating. It's fine. It's good. It's great. Food is great.
But what I'm trying to show you is that if, in some cases, the pain associated with continuing that defense mechanism is greater than the pain associated with change, it helps people change in some cases.
Not in the long term. And I
Don't
struggle.
agree with you.
Pause there.
agree with
Sorry,
you.
you've been voted out by the majority.
Got
Please
him.
return to your seat.
So earlier you were speaking about how there's randomized control trials that
There's
show.
emerging Mendelian randomized control trials that have now shown us that obesity is causal to all-cause mortality.
Okay, so I disagree with that. I think there's
I
going to be a
have
problem with
dozens.
This.
In
So
fact,
here's
check them.
why I disagree. Because
You can disagree.
No,
but
but let me
there
let me hear me out.
dozens. Okay.
Okay. So the reason why is because registered dietitian, school for 6 years, studying nutrition, weights, all this stuff, and
Tell
we
me
can't
what
keep.
lipotoxicity is.
It doesn't come off my curriculum because it's bullshit. Because it's a TikTok thing
is
that's
it?
like.
Is dietitian the practiced or the protected term, or is it nutritionist? I think dietitian is the protected one, right? So this is a real job she has.
And
Tell
we
me
can't
what
keep.
lipotoxicity is.
It doesn't come off my curriculum because it's bullshit. Because it's a TikTok thing
is
that's
it?
like,
What is
cortisol
it?
face or whatever.
It's
But please,
not.
just
Listen
back
to me.
studies.
It is not
Back to the
bullshit.
studies, back to the
It's
studies.
ectopic fat.
Look, can we just
It's
say,
when
because you keep
fat
sidestepping
ends
and then
up-
we
I'm
never
not
get anywhere.
sidestepping. This is the claim.
Okay.
The claim is that obesity is unhealthy. Lipotoxicity
But the
is
reason-
not bullshit.
but-
it is the definition of ectopic fat.
It's
When
funny it never
fat
came up in
gets
6 years of a
deposited-
professional accredited
What's fatty
undergrad.
liver disease?
I know what fatty liver. I was a
What
clinical
is it?
dietitian in a
That's
hospital.
lipotoxicity.
Okay,
Okay.
so-
When fat is in the liver, when fat is in the heart, when fat gets deposited in the brain.
Yeah.
That is lipotoxicity, and it happens when the body has no place to put the excess energy anymore.
Okay.
It is irrefutable that is bad for your health.
Can we just go back to the correlation doesn't equal causation? So you're saying there's causal studies, right?
Yes,
Okay.
MRT studies that
The
show.
acronym's great. Okay. So my thing is the reason why we cannot show that the fat in and of itself leads to the negative health outcomes is because we cannot keep a human in a lab and control every factor, but have the only thing
why
that's
they
different.
use Mendelian randomized
But can
control
you just
trials.
listen? So a person
inherently eliminates any conflating factors because they're based on genetic predispositions coupled with
But can I
lifestyle.
just share? A person in a larger body has experienced things that we can't undo.
This topic and transports are the topics that make me want to die because lefties cannot acknowledge that there are some things they cannot defend realistically. Well, but the issue is that like the vast majority of people on the left would not defend this idea. These are just like the crazies that they find.
From the fat. So for example, they might have negative health outcomes because every time they go to a doctor, instead of being given an evidence-based treatment, like I have unearned thin privilege, I go to a doctor, I say, my stomach hurts. I get a full
You're
workup.
basically saying the earth is flat. Are you trying to tell me that having fat in your liver,
I just wanna talk
having
about
fat
hormones.
in your heart, having fat deposited in your brain is healthy?
No, I just want to talk
Okay,
about.
so no, you're not trying to say that it's healthy.
No, I'm not trying to tell you that, is what I said. I was never talking about the health of it.
Okay.
I'm trying to say everything you're saying is hinging on this idea, and it's a problem that we disagree on it, that it's the weight in and of itself that leads to the negative health outcomes. You're saying this MRT totally is.
Fat is an endocrine organ.
I know, but can you-
it
what about-
releases,
but-
it destroys your hormone balance. It creates insulin sensitivity.
What about
when
the
the
fact-
body has too much fat, it releases insane amounts
Yeah.
of different.
I just wonder, have you heard of social determinants of health?
Tell me about it.
Okay, social determinants of health, a group of factors that impact someone's health outcomes.
Okay.
That are things like your healthcare access and quality, neighborhood and built environment, things like your stress levels, socioeconomic status.
Okay.
Here's the thing. A person who's
Oh, I'm about to come if she says food deserts in the next 10 seconds.
fat or lives in a larger body, we can't take away that person has probably experienced higher stress levels their whole life from experiencing marginalization every corner, from shows
Okay.
like The Biggest Loser to the doctor's
sure.
office.
Okay.
We
Never
can't take
mind.
away that they
didn't
haven't
get
been
that.
given evidence-based health options because when they go to a doctor, they're told to go lose
When
weight.
fat gets deposited in
But
the
you're not-
brain,
you're not answering what I'm
how
saying.
does
Wow,
I'm
Wraith will die. Thank you for gifting one sub in Kick Chat.
confused? Are you suggesting
Wow,
these are
Morgan, thank you for being a tier 4 subber in DG Chat.
the reasons people become overweight?
No, I'm suggesting that a person could be in a larger body and be perfectly healthy based on
Do
their
you realize
lab,
that
their
only
cholesterol.
7% of people who are classified as overweight or obese, call it whatever you guys feel comfortable with, only 7% are classified as healthy.
Say that was true. Say we
I
knew
can-
for
I can go
certain.
back
Wait, what does that mean? Classified as healthy. What does a healthy classification mean? Also, I don't know why she said overweight or obese. I'm pretty sure those refer to two different BMI ranges.
Data for you right now if you
Okay.
want.
Say we knew for certain that it was unhealthy, that what you're saying is true. Even
And
then,
here's the
but even
classification.
then we'd be in this place where, okay, so what do we do? Are we going to send someone down a path of trying to lose weight and then gaining and trying and gaining? And we know that weight cycling in and of itself, bad for the heart, bad for insulin, bad for the
What do
brain,
we do?
bad for all the things.
We work with that individual.
That's what I do in my private practice.
Well, that's wonderful.
Yeah, and I don't encourage weight loss because it's unethical.
I disagree with you.
And
I
what's
think it's
ethical? You were
unethical.
asking before,
I think
what do
it's unethical
professionals
not
do?
to be transparent with people
And
about the
transparent-
dangers.
Yeah, transparency is the dangers of weight cycling. You can go down that
That's
path.
a separate issue. You're presuming they're
How-
weight cycling. If you're doing your job, they shouldn't have to weight cycle, right?
No, it's not about me. It's about the body. The body is so smart. But we're animals. Our bodies, when we lose weight, our body goes, oh shit, she just starved me. I'm gonna do everything I can to try to get back to that place.
think it's
Drive
more
up thoughts about
complex.
food.
I think it's more
slow down
complex.
metabolism to conserve the energy you are getting.
So are you suggesting that because it's hard and it's multifactorial, we should negate the dangers and not try to
I'm
get
suggesting
healthier?
that it's more dangerous to weight cycle than it is to stay in a fat body.
Still not the claim. And if you want to show me that, I'd like, sure, show me the data. I'm not going to argue with that. It's not healthy to do that either. That's still not the claim.
your claim
This
is
isn't a
fat in and of itself.
hierarchy
all
of
right,
what
we're
is
out
unhealthy.
of time. We have to pause there. Yeah, thank you for that exchange.
Wow.
Who put these here? Can someone remove these off the...
What is the next claim? Large food companies are the primary benefactors.
Nice to meet you, Siobhan.
2, 1.
Body positivity movement. My next surrounded claim is that the large food companies are one of the primary beneficiaries of the body positivity movement.
All right, if you want to be the next debater, get to the chair in 3, 2,
I feel like this is for these people is kind of a brutal, but
1.
I mean, 1 second.
Hi. How are you? I'm Siobhan.
Nice to meet you, Siobhan.
So, what are you classifying as large food companies?
Okay, PepsiCo, Coca-Cola, General Mills.
Okay. Now, if they were beneficiaries and benefactoring and making all this money off of the body positivity movement, why is it that they spend billions on calorie counting apps, on a lot of things that we see in society as forcing the losing weight or talking about losing weight? Because that to me doesn't make sense and doesn't correlate. But also, people that are benefiting from this are the people in the body positivity movement themselves. A little bit about myself.
Wait, can I clarify
Oh,
one
please,
thing?
please,
I'm
please.
talking predominantly about finance.
Okay.
Sorry.
Perfect. Thank you. Even that, I still will say, so I come from the wedding industry. So I created the first publication in the world for plus size brides. I've now gotten 13 wedding publications around the world. And my biggest thing is the wedding industry is very centric on this is what the wedding industry looks like. I have created a platform where and not just larger bodied body positivity, but body positivity for all sizes. And I'm going to come specifically from the wedding industry, which is very different, I know, but it still is very weight centric.
Okay,
Yes.
so your argument is the wedding industry is the primary
No,
beneficiary?
I'm not saying that. I'm saying that's where my knowledge comes from. But the body positivity movement is really for us. We are the main, and I'm saying we because I'm a large body person.
I totally understand.
That's where it's
Can
really
I show
coming
you
from.
the ways
Please.
they're exploiting it?
Oh, please,
Okay,
please.
so there have been two really big exposés, one by the Washington Post and one by the Examiner. So they're coming at this from numerous angles.
Mm-hmm.
So the first one is they've gone after a lot of the intuitive eating dietitians.
Okay.
So can I give you some statistics?
Please.
Okay, so Washington Post analyzed more than 6,000 social media posts by 68 registered dietitians with a combined reach of over 9 million followers. 40% of them were using the anti-diet language, right? Like food freedom, no food rules, ditch the diet, healthy in any size, so on and so forth. Very often not disclosing the fact that they were paid by the big food companies.
Okay.
So they're basically going after the intuitive eating dietitians. I can give you Abby Sharp.
That's okay though, but I want you to listen.
Okay,
because
yeah.
they are doing that.
Yes.
But the aspect that the body positive movement is really for us, that is not even anywhere we need to equate into it. It
don't
really
agree
is.
with you. When
And
they're
that's
using
fine.
your movement.
But do you, and I'm gonna say this clearly and for right now, I don't care who uses my fucking movement. I want the movement to be there. And that right there, they can take it. It's marketing and sales 101. Of course they're gonna use the fucking movement.
But then
Because
why
they're-
can't you guys say you don't get to co-opt our movement?
That's not for me to do. I don't care about that. The thing is we don't
you
care.
should.
But it's not about we should. We are doing what we're doing because this is our family. This is our world.
There are
It
people
doesn't matter
that are
about what.
exploiting
Do you
your
think
family.
But the thing is, we don't care. We are the movement.
But there are a lot of people that are being hurt by this. And these guys essentially are engineering food to be addictive.
The biggest red flag for people when it comes to like the health at every size or body positivity is on the other side of it. The people who are attacking it are people who hyperfixate on it. Like the reason why everybody's getting fat in society is because of body positivity, because of health at every size. Most people don't think this. Most people that are fat know that it's gross. They know that it's bad. They don't want to be fat. Like the idea that body positivity or health at every size is like moving the needle on people becoming fat at all is fucking retarded. That's like the biggest red flag for somebody who fixates on it. Now she's invited to a Jubilee show to debate the other side of this, so maybe she doesn't fixate on that. But some people dramatically overestimate the impact that body positivity has. Or like if we got rid of that, it would move the needle a ton on how many people in the country are overweight or obese.
And you know what? And I will say this. I will say this.
Yeah.
I will give you the claps on that. I will say, yes, that is true. But what I do want to say is that it happens all the time. A movement starts and someone comes in and takes it. And someone comes in and comes in and someone comes in and runs with it.
You don't deny it, you just don't care. is what you're
No,
saying.
I'm saying it's fine for them to do that. But the bigger issue that I want you to realize is that the body positivity movement is ultimately for us. If someone wants to come and get on our coattail, that's perfectly fine. But for us, it doesn't need to go away. It doesn't need to go
One's
anywhere.
asking for it to
doesn't
go away.
But
I'm
it's
suggesting.
now, see, there's a suggestion.
Okay.
I like it. I like a
Okay.
suggestion.
I'm suggesting that it could evolve, that you guys could call out when you're co-opted, that you could centralize messaging so that it's not all over the place.
Now that, Julie,
right?
I am not opposed to.
Okay,
I'm not opposed to that.
I'm not saying it. That's not a claim.
No, but the thing is I want you to know who the true beneficiaries are. You're saying that they are the main beneficiaries.
speaking financially.
Yeah, and
I
that's
apologize.
Okay, and that's okay. But you're saying the claim says that the large food companies
Yes.
are the main beneficiaries of the body positive movement. That is not correct.
I understand.
Because we are the main people. We are the main beneficiaries of the body positive movement. If someone wants to come and get on our coattails, go ahead.
Disagree
do
with you on that. I
And
think that's a
okay.
mistake.
And that's okay.
I think that you guys could tell them. You could expose what they're doing. Like, can I read you something else?
Please.
Okay.
I'm here to
Can I
hear.
just show
Just
you
like this is a
how
great dialogue.
diabolical this is, okay?
Diabolical.
I have a friend that's on the inside. He sent me this. He goes, I just want to show you the ways in which this is being inside of I can't say that a big food.
company.
You got it,
Yes,
exactly.
yes.
Okay, so here's the intentional message overlap, right? So healthy at every size. Quote, you can be healthy at any size. Corporate benefit. Removes health concern barrier to sales. Stay with me, okay? Dieting doesn't work. Protects snack foods from being cut. Healthy at any size. Weight and health are unrelated. Corporate benefit. Deflects from products causing obesity. Healthy at any size. Weight stigma causes disease, not weight. Wait.
Okay, I'm
I'm just showing you. This is
what I
an
want
internal.
to bring,
Yeah.
what I would love, and I'm saying love because I want it, but I love it more. If there is such a resistance to the body positive movement, and I'm speaking specifically kind of from your
me?
standpoint,
Okay,
yes.
yeah.
If there's such a resistance to the body positive movement, why are you letting them take money from you?
Where's
Why
the
are they-
resistance? I'm
What
telling you.
resistance
I'm
are
telling
they-
you. Body positivity movement oversimplifies disordered eating and trauma.
All right, whoever wants to be the next debater, get to the chair in 3, 2, 1.
I'm not going to assume, but I imagine you have some sort of maybe personal experience with eating disorders or disordered eating.
Definitely as a kid, would overeat. I wouldn't say binge eating disorder, but I would compulsively overeat. I would eat, have a connection with my father. I would eat to feel a sense of comfort. I would eat to feel a sense of control, without question.
And did you?
Hot take, gym bro culture is probably way worse than the body positivity stuff because everything you can reproach about body positivity, you can do 1,000 times over for gym bro culture. Not to say inducting gym going into the cultural fabric is bad. Inducting gym going into the cultural fabric is bad, but it has also absolutely mind raped the average person's perception of what average looks like. I wouldn't call that gym bro culture, though. I think that's more like TRT, drug, online influencer culture. I would say more than like gym bro culture.
Feel shame and then go to therapy.
Also, the only reason why we talk about body positivity movements and health at every size movements and obesity as like a huge problem in society, the 99% of the reason why is because men think that women need to be optimizing themselves to be fuckable at all points in time. And when men look at overweight women, they feel like they're not designed for their personal masturbatory fantasies, and they get really fucking ass-painted about it. I 1000% would die on that fucking hill, because you will never, ever, 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 ever hear men come out and speak about how horrible eating disordered people are, like people that are anorexic or bulimic or whatever. You'd never, ever, ever hear a single fucking concern about these people. But that being said, you shouldn't be overweight or obese.
Therapy to work on that, or did you just oversimplify it and then kind of...
I didn't oversimplify. I was 13, 14, and 15, so I didn't have...
Men shit on fat men too. The only possible way you can think that fat men get anywhere near the same anything as fat women is if you are a man. And I love you and I appreciate you for that.
The bandwidth to process.
They do get shit on because nobody wants to be fat, but there's a much wider diversity of acceptable male bodies than there are acceptable female bodies, 100%.
Actually going on. I was in therapy for other things that were going on in my household, and I definitely was helped.
Okay. So I'm glad that you're able to, go to therapy. That's not something that everyone is able to go to. It's a luxury and a privilege for a lot of people, especially in the United States. I have dealt with an eating disorder since I was 7. That's when it was first realized. It wasn't diagnosed at 7, but it was realized at that point. And my body fluctuated. I'm not going to use numbers because I think there are a lot of people that have disordered eating that use numbers as a metric. And so they'll look at me and I'll say a metric, and then it'll cause someone to have what I like to call a shift in where they are now to where they're going to be down like a rabbit hole of disordered eating behaviors. I think that trauma and eating disorders go hand in hand, but they're not exclusive. There are people that don't necessarily have any trauma, but somehow have developed some sort of eating disorder. My eating disorder was something that I had from a really young age, and then just worsened because of my physical perception around people. But it wasn't something that innately was trauma-based. I am neurodivergent, and it was never diagnosed until I was, almost 30. So that's not because of trauma. That's just because of my neurodivergence. That's how my brain is connected. And so sometimes with neurodivergent people, they have eating rituals, eating routines that are rigid. And so that's where mine came from. So to say it's oversimplifying.
I've never heard this connection to where if you're neurodivergent, you also have to eat in a way that makes you fat or whatever, but okay.
EDs, like body positivity, is oversimplifying EDs, oversimplifying trauma. You're taking away the people that use the body positivity moment to find someone who they can relate to, and so someone that they can connect with that doesn't have the same road that maybe the masses had, but has their same road.
You've been voted up by the majority. Please return to your seat.
Hi. I'm Summer. How are you?
Jillian, nice to meet you.
Nice to meet you. Okay, so the body positivity movement actually got me out of my eating disorder, and if that's okay, I would like to tell you a little bit about it.
Absolutely.
So growing up, I wasn't ever fat. I just have large breasts. I have got a condition, basically. I know you're laughing.
I'm laughing because that would be my dream. That's the only reason I'm laughing. I was like, poor you, Summer. I'm sorry, go ahead. Not to try to invalidate how you feel.
That's okay.
Sorry,
okay.
Go ahead.
So I've got a condition called macromastia. It means that my breasts will just continuously keep growing. So I had to deal with this my whole childhood, and I got picked on and bullied and stuff because I was 8 years old with double Ds. So that's absolutely okay. I went to the doctors and they actually told me that I had to lose weight in order to get a reduction. At this point, I was actually a Scottish size 6, which is a UK size 2. So on the bottoms, just obviously not on my top. So this actually drove me into an eating disorder, and I started to starve myself and try and make myself thinner so that my breasts would get smaller, and that never ever happened. They just continuously, because it's obviously a condition, so they just kept getting bigger as I was getting smaller and smaller. And it wasn't until obviously the online platform made the body positivity movement more aware to me, and then that really, really helped me. And it made me start eating more. It made me start posting more online about my body, and I just think that your claim's a little bit silly.
Can I give you some examples?
Of course, please.
So, while intuitive eating is actually not intended for people with eating disorders, I cannot tell you how many people have misinterpreted that, and I've ended up dealing with it personally for quite some time now. So, for example, things like avoid diets where mechanistic eating is actually recommended for people with many different types of eating disorders. And even the women who started intuitive eating suggested that, hey, this is a goal, not a treatment plan. But when you've got, random people online who are, hey, just listen to your feelings of fullness. You can't do that when you're anorexic. Your body no longer recognizes those satiety cues. It absolutely shuts it down. But it's, what was it? Listen to your hunger. You cannot do that if you have binge eating disorder and you're feeding a deeper hunger. It's the fundamental ways in which things like intuitive eating have been misrepresented by the masses. And of course, I understand what it was intended for. But if you think that the vast majority of these people posting on TikTok have read the freaking guidelines of mechanistic eating, I think we're both dreaming.
No, I get that, but I think the thing in my head is like, why do you care so much about someone else's body in order to like try and argue against body positivity? Like, say someone's like fat, obese, whatever, walking on the street, that doesn't actually affect you as a person.
Totally right.
So I don't understand why you would feel the need to fight for people that are arguing for that person to feel validated as a person.
I'm not arguing for the person I don't know. However, there are people that do want help, and I think that this can leave them feeling exceptionally confused. And there are many that I have tried to personally help that have experienced feeling misled, misguided by some of the, or almost all of the intuitive eating principles, and they're not being educated on
But
that
you could
fact.
also argue like the latter.
But there are a lot of people that actually want help, and I care that they get the most
But I don't think the
efficient
body
help.
positivity movement is like just for obese people, just for people that are drastically
And
need help.
anorexia is
It's
not
for-
obesity?
So I was anorexic, and the body positivity movement helped me. Do you not think that the body positive movement helps them rather than
I
shaming
think
them? Because
that-
that's how they get in that place in the first place, with other people shaming them
Wait,
constantly.
why is this one claim 40 minutes or whatever? Or did they just forget to title the next claim?
I'm not suggesting anyone should be shamed. You're completing two different issues. I don't think
But
that
I
people...
think in one, it's all one issue.
It's not though, sweetheart. You're telling me that you think I think shame is awesome. I don't.
No, I didn't.
I don't.
That didn't come out of
I
my
think that these tools or things like, oh, you know what? It's society, it's diet culture, it's this, it's that, it's bigotry. No, dude, it's probably the fact that like somebody, God forbid, touched you when you were a kid.
I don't
or,
think that's appropriate or even right. And the slightest bit.
You
No
really
one
don't
touched
think
me.
so? No, not you, dude.
No
I'm
one-
not talking about you.
No, I completely get it. And
I'm not
you
talking
also-
about
It's
you.
a little bullshit that they brought her on because she legitimately, well, maybe not, I guess. This person sounds like they legitimately had a serious issue that also might have been misdiagnosed. If she wanted did she say initially she wanted a breast reduction, but they said she had to lose weight first? I don't know what the ordinary guidelines are for that, but it sounds like they didn't have, they hadn't diagnosed her with this mammo, whatever the fuck thing early on. Maybe, I don't know. But this is obviously like, my understanding is this is an incredibly rare condition. I've never heard this in my entire life before. So macromastia.
You mentioned like parents. I have two very loving parents. My parents never made me feel shamed about my body. It was like TV shows like The Biggest Losers. In the UK, we've got Super Size versus Super Skinny. Like it was all of these TV shows that made me feel like this. It wasn't my parents.
I'm going to suggest that I don't think you would be vulnerable to TV shows.
Why?
If there wasn't a primary injury. Because who cares, buddy? Do you know how much stuff like goes after me personally or after people of color? Or
This is retarded. This is about as retarded as what the other people were saying. Of course, TV and social media and everything else is going to heavily influence how we feel about the way we look. This is, okay.
For gay people or after, like,
You have to remember, I'm quite young. So when these came out, I was very young, very impressionable. And I have like adults telling me that my body, because my BMI is higher, I have adults telling me that my body is like, you have to lose weight to fit in with normal people. Like you're young when you're
when that
impressionable.
happens-
And for you to be arguing against like body positivity, like I hope you don't have a daughter, because my little sister, like, needs the body positivity movement. I think people need the body positivity movement because without it, everyone's just going to be looking at other people, judging other people. Like I'm sure.
You think the body positivity movement is stopping people from being assholes?
No, that's not what I said.
I think you're not right about that.
No, that's not what I
definitely
said
don't
at all.
think- You just said you think it stops people from judging other people.
Yeah, well,
no shot that's going to happen.
They're
It's just
not
not going
judging
to hide it
people
from
on their
you.
size or what they're
Of course they are.
They're not.
Okay, pause. You've been voted out by the majority.
That's okay,
Please
thank you.
return to your seat.
Really nice to meet you.
I just looked it up. Apparently only 1 to 5% of women suffer from that condition. 5% of women? 1 out of 20 women have boobs that grow forever? Or did she not describe the condition correctly? There's no shot. That's way too high. This has to be like a 1 out of 50,000 or 100,000, or at least with the severity that she has it. That's got to be an incredibly rare condition.
Lilia.
So I think the language there is a little bit tone deaf, just because I actually believe that gym talk, diet culture, oversimplifies eating disorders.
Two separate issues, though. Both can be true at the same time.
Both can be true, as in
you could absolutely be making, first of all, gym talk should have nothing to do with eating disorder. So you're right. But it's a separate issue than the claim I'm making.
How is it separate?
Well, okay. So you're saying gym talk oversimplifies trauma and eating disorders, right?
Well,
I agree
not
with
just
you.
gym talk, but just the way that our youth, all of us we are all exposed to that. Like we can't just avoid it. And when
Still
you
a separate
see
issue, though. I'm trying to say that the ways body positivity suggests people deal with body issues and trauma is an oversimplification. And it has to do with things like intuitive eating principles that get misrepresented by influencers.
Okay. I can definitely agree with that.
Well, then, unfortunately, you and I are so far on the same page.
Well,
here.
no, I think, well, the way I see it is that body positivity is actually the bridge between health experts and anybody else, really.
Explain it.
Because I think that if I go to a doctor, it should be empowering for me to talk about my body.
Of course.
However, when I usually speak to a health expert, it's really not. I'm really more just afraid that they're going to speak to me in a way that degrades my body and makes me feel that shame that you've mentioned. Shame is not a motivator. It really turns people away, whereas the body positivity movement teaches people to have the kind of confidence they need to make choices for
How's it
themselves.
teaching that?
when you look at yourself in the mirror and you tell yourself, I'm ugly, I'm fat, I'm gross, I don't deserve to be, alive, to like some people get to that extent, right?
I understand.
When you do that to yourself, that is not going to motivate you to then go make the choices that I think we all know are healthy for us.
Totally agree.
Which doesn't.
Then what's the next step though, dude?
I think that's what we're here
Just
to,
looking
to
in the
speak
mirror
about.
and
I think
saying,
that's what-
actually, I'm healed.
So that's not what body positivity. That's not what body positivity is. Body positivity is promoting the healing of said wounds.
How?
By
This is where
finding,
I'm telling you, it's an oversimplification.
it's not though.
Tell me
because
how.
you're- because
How
by
is it going to
telling-
heal you?
By
By
telling
looking
people
in the mirror and
by
saying,
looking at positive.
Molested, parents, this and that.
Yes.
I've heard of someone mention the BMI.
and we have DEXA, and we have MRI.
Yeah, but let's be honest. What are they getting our info now? I've never seen a full episode of The Biggest Loser because my parents told me to watch it, and I said all the way off.
Right, but you have no rage at your parents whatsoever, right?
Oh well, I'm not fat because of the age of my
all the way
parents.
off. That doesn't sound like a primary wound telling your parents to all the way
But
off.
the
Is that
primary-
not evidence of what I'm saying?
Totally, primary wound plus genetics.
All of the things, type 2 diabetes, the beginnings of chronic kidney disease, arterial plaque, all the things that are legitimately alarming. So I can't get her on this freaking ladder. It's day one. Can't get her on for 15 seconds. Tried everything. Cannot get her on this ladder for 15 seconds. And we're playing this out and we're playing it out, not getting anywhere. Because the story is, I'm weak, I'm fat, I'm worthless, I'm this, I'm that, all the internalized shame. And at that moment, I pretty much tried everything. What you don't see is this has gone on for about 4 hours and I can't get her on the freaking ladder.
80% of people that went on a public TV show.
All right, we got to pause there. We are out of time.
My final surrounded claim is that the body positivity movement is fundamentally disempowering.
If you want to be the next debater, please get to the chair.
Okay, I just didn't tag this correctly.
In 3, 2, 1.
Hi, nice to meet you. Hi, Zane.
What form or what do you mean it's disempowering?
Well, I perceive it as follows. First, it's externalized shame, as opposed to appreciating that this is something that does arise within. And if you'll hear me all the way out, I think I can illustrate that for many, it is actually a choice, which I know sounds shocking.
I think there's some people that are inspired by the hatred of their body and that they'll lose weight even at a rapid pace, losing like 30, 40 pounds a month, which we know is not healthy.
Depends
Sometimes like
on how you lose
losing
it,
like,
yes.
yeah,
For
right.
the
like,
average person,
even,
yes,
like,
I agree.
I think people agree that, or I've seen 5 to 8 or 10 pounds a month is kind of what you want to do in a healthy, like rapid, a way to lose weight. And I think sometimes if you're doing too much, and that's right.
It's not realistic
And it can
at all.
become unsustainable if that can
Absolutely.
happen. So that's kind of what I would say. And because body positivity was such a gateway for me.
For the majority, please return to.
So wonderful.
Okay, it was a pleasure, and thank you for sharing your story.
Hi, Solstice.
Hi, lovely to meet you.
So you said something about it being inherently disempowering because you don't believe you can make changes, right? Am I
No, I'm
misunderstanding?
suggesting that there is no framework. There's no, now that we've accepted where we are today, what can we take responsibility for, and how can we take action?
Sure.
There's no shot that this does not feel so unbelievably uncomfortable. I can't believe that. What the fuck? What?
So are you familiar, you brought up a quote of your own. Are you familiar with the quote to those accustomed to privilege, equality can feel like oppression? Do you
no.
understand how weight is interactive and intersectional with all these other identities? When somebody is a fat person, it intersects with other aspects of the world that have marginalized them.
Give me examples.
Example of a person, or?
No. Of how you're feeling, in ways you feel marginalized. And listen, who are you speaking for?
Anyone. I don't think it's about a specific person. I think
Oh, God. How do you have shit like this memorized, but you don't have a fucking answer for it? Broadly speaking, right, like intersectionality is how do different types of identities you have intersect with others in society, and then how can these like uniquely manifest ways that you engage with society. So like a fat woman, the easiest one is she's a fucking woman. A fat woman might be treated differently than a fat man, right, which I think is obviously true. Or fatness in some cultures for maybe black women in fucking rap videos might be different than fatness in other cultures, like for white women. I don't fucking know. Like, how do you not even have a single example of this if you're going to rattle off how important your intersectional analysis is? That's crazy to me that you couldn't even think of a single fucking example of this.
Speaking for?
Anyone. I don't think it's about a specific person. I think when you say that it is important to take responsibility for what you can change, you seem to have acknowledged that at the beginning, at that first stage of acceptance or of understanding, that you are trying to acknowledge that you can't hate yourself into a version of yourself that you can love.
No, not really, no.
You can't.
But what I do think, hear me out, I do think that when you are feeling pain or shame, it is a signal to explore. I do
Absolutely.
think that.
And I appreciate that you're coming at this from a place that involves the mental health as well. It sounds like you would be pro-therapy and pro-understanding where these roots come from.
Yes.
But again, you can't change yourself. You can't go into changing yourself from the expectation that that will make you feel better about anything. And I don't think that our choices to make changes about ourselves reflect more self-love necessarily. They can. Okay. I think if you choose to take, if you are choosing to take care of yourself, that comes from something within you that feels good for your body.
Okay.
And so the body positivity movement to me is not inherently about, it's not about taking, diet culture and just.
It is, but wait, just so I can change how I respond to it. I can't.
That we are thin enough either.
Who's relying on that?
Plenty of people.
Do you realize 74% of the country is overweight or obese?
All right, pause. You've been voted out by the majority. Please return to your seat.
I'm curious about what your definition of body positivity is, because you're talking about shame and you're talking about
Is that her real name? Tigress? Her birth name?
personal feelings and emotion. And I have a little bit different of a definition of body positivity.
Some of yours.
So when I think about the body positivity movement, I actually think about its roots in the fat rights movement, which is where I work.
In the 60s,
right?
yeah.
The fat rights movement? I'm sorry. There is evidence that people who are overweight can sometimes be treated or they don't get the best type of medical care when they go to the hospital because people are too quick to ascribe to their weight or whatever medical conditions when that might not be the causative factor, or they're not giving them a fair shot or whatever at whatever type of diagnoses. Or at least I've heard this said enough. I'm sure there's a study out there that says that. Same thing with like other minority types, like women or black people or whatever else. But
in the 60s, I run NAFA, which is a fat organization that was founded in the 60s. And when I think about the folks who have been using that terminology since the 70s, 80s, 90s, not just the people who kind of popped up using it on Instagram and Tumblr in the 2000s, but that it has this long.
Does the overweight/obese metric account for people who have a lot of muscle so they're heavier? BMI? No, BMI is only a function of your height, weight, gender, or sex, whatever, and I think age.
History. That long history is actually about body justice.
I know.
It's not just about
Body
individual
justice.
feelings. It's not just about, my mother-in-law said something to me at dinner, or this guy didn't want to date me because I was fat. It's actually also about things like, do I have access to healthcare, weight-neutral healthcare that actually treats my symptoms, not just my body, right? Do I have access to equal pay? Do I have accommodations for the body that I'm in right now, not the body that I might be in someday? And so I think about these systemic disenfranchisements and discriminations that happen to people, especially people in larger bodies. Yep. And when I want to embrace body positivity, it's more than just that personal self-esteem piece.
Right.
But what you seem to be talking about is the personal self-esteem.
Not true. That's not just what I'm talking about. And I'm not going to disagree with you on any of what you just said. I'm well aware of where this started. And it was, I think, a gentleman that was pretty upset about how his wife was being treated, right? And he started it.
How'd you know that origin story?
I do know a lot about it. In my opinion, there's no question it has been co-opted. And when the vast majority of your TikTok influencers don't know the origin of your story, and those messages are communicated in 15-second memes, then you own meme consequences. And that's where I take umbrage with it. And it's become this amalgamation of rolling up different movements along the decades. So we can't be like, well, I'm going to carve out the part that's the right.
It's true, but it's largely when you hear hooves, think horses, not zebras. The knee pain in a 300-pound patient is probably their 300 pounds, not a rare tropical parasite disease. Yeah, it could be, but I mean, like, it depends. There's going to be retarded doctors and there's going to be retarded patients. Like, if you come in and you've had knee pain for, a decade and now it's getting like pretty bad and you want some diagnoses and you're 45 years old and, you're 400 pounds, the doctor's probably looking at you like, okay, what do you want me to do, chief? But if you are 30 years old and you are 5'8", 5'9", and you weigh 300 pounds and you go to the hospital and you just, like, as of yesterday, started to develop some kind of like severe acute knee pain, and you're like, doc, my knee is fucking me up. And the doc's like, bro, you're fat as fuck. It's like, okay, but that's probably not the cause there, right? Like, there's going to be different. Ideally, you're doing a more holistic analysis of the person than just seeing, oh, you're fat as fuck. Then this like sudden onset thing that just started happening yesterday is probably because you're fat, like.
Rights piece, and don't look over here. I look at it in its entirety, and there are parts of it that I take umbrage with.
BMI formula is purely height and weight. Okay, the formula might be height and weight, but there's a different healthy BMI for men and women, because I know they have different charts or whatever. No.
That's how I feel about the health and wellness industry, right?
That's fair.
I think in its entirety. There are parts that I take umbrage with. And when you introduce yourself, you talked about being a health advocate. Does your advocacy include making sure that people are not discriminated against?
Without question.
So how do you do that for
advocate
people
for
in
that.
larger bodies?
Well, personally, I don't get involved in that kind of policy outside of what I do in relationship to big agriculture, big food, big pharma, big insurance. That's my primary focus when it comes to policy. To be dead honest, I think you probably do a better job in this area than I do. But I would never, ever disagree with you here. I would cooperate with you in any way you ask me to.
So would you say that it should be against the law to discriminate against people based on their body size?
Unquestionably.
So why don't we see more fitness and wellness advocates asking for that?
I'm happy to ask for it. I'll ask for it right now. I didn't know that you thought I wasn't for it. Of course I feel that way.
Well, I didn't know your personal view on the laws specifically.
What is it?
I think of people who have been really hurt, rejecting the things that they have felt rejected by.
So
All right, pause. We're out of time. Please return to your seat. Okay, Jillian, great job everybody so far. We have 10 minutes for one final debater, so look around the room and select somebody who you would like to spend that last 10 minutes with.
BMI doesn't always account for muscle mass. I don't believe that BMI has anything to BMI is literally just your weight and your height, and then I think you're healthy or unhealthy based. It'll be different for your age or whatever, but if you want to start measuring that, you can do like calipers to pinch people and take measurements and see how much fat comes off, or you can do your water submersion things. You could do DEXA scans, but the other term there, I think you would have like fat-free mass or body fat percentage or whatever, or lean muscle mass or whatever.
Maybe who you think you haven't finished the conversation with, or you think they challenge.
But you're not going to know that from BMI. BMI is just like an at-a-glance snapshot, basically.
In a way that you want to keep moving.
I want to talk about the genetics piece. Okay.
My surrounded claim is that shame is far more dangerous than body positivity.
I don't disagree with you. I disagree with how it handles shame.
Let's talk about the show.
Okay.
Tell me more about your, I guess, tactics or who Jillian Michaels is to the world.
I can't describe who Jillian Michaels is to the world. I'm something to everybody. To some people, I'm a hero that saved their life, which I never, listen.
35% of people.
Hold on. I disown that completely. It's not my accomplishment. It's a projection, right? Of I know you guys don't like this talk, but it is a projection of the good mommy. I'm not that. I'm also bad mommy. I'm the evil person that made them overweight and I did this to them. I'm all these things to all these people. Who's Jillian Michaels? I mean, I'm 5'2". I spend a lot of money on laser hair removal. I got 2 kids. I mean...
How do you raise your kids? You use fear and shame to raise them?
Does it seem like I use fear and shame to raise them?
Yeah, because you talk about using fear and shame.
I don't talk about... First of all, that is a life or death intervention on a ticking clock.
But do you look at me and see a life or death need for an intervention right now? Be honest.
Yeah.
You might.
Yeah.
I do.
Yeah.
We don't have a ticking clock.
Probably.
Which means that if you chose to reach out to me...
We're
to
all on a
maybe
ticking
work on-
clock.
Not in the way that you go home in a week, dude. In the way that I get 6 days to try to figure out, to try to help you.
Okay, so you're back
very
to the
different.
show now, the ticking
I
clock
thought we were
being
talking about, well,
sure,
you're
sure, sure.
asking me about fear, and I'm telling you that parenting and Biggest Loser, there's no parallel.
Okay, so shame.
Okay.
Shaming someone. So like,
I didn't say it's okay to shame someone. I'm telling you that the utilization of these emotions, I'm telling you that shame is a signal. It's telling you, hey, look over here. This here. So,
but shame from the world. Like any shame I've felt from, okay, we'll start here.
Shame from the world. You're externalizing shame, which is exactly what I don't agree with.
And you're saying that I've externalized it by carrying it on my body as well.
No, I'm saying...
That's a little bit of what you said earlier about the trauma is
hold on.
externalized.
Well, that would be utilizing your body as a container to manage emotions. If we're talking about in this particular instance, I can give you an example of that, but we're not. So I'm not talking about shaming someone. I fundamentally disagree with that concept. I'm talking about the shame that is already there, not externalizing it. I'm talking about appreciating the fact that, like, okay, this is arising from within me. Where is this coming from and why? If we, instead of going, oh, I think I'm ashamed because of what they did or what they told me or what... Now listen, people are absolutely, at one point or another, very often victims. However, how we choose to respond to that injury, okay, at one time, absolutely meant your psychological survival. It is how you survived that injury. The problem is it perpetuates and it no longer serves. But if we continue to repeat the pattern, it's actually called, has a name, it's called a repetition compulsion. And the goal, right, is I will master this. I will play this out. It's safer to play it out externally than where those feelings really belong, because that's painful. It's also safer because you don't have to suffer the primal loss of whatever was missing. So now, can I give you an example? I'm a shitty parent. We talked about this, but just follow me, right? I'm a shitty parent. I'm not there for you. Okay. Instead of you saying, oh my God, my mom was never available. I didn't get what I needed. And there's there's
peoples that feel that way.
Okay. We then internalize it and go, it must be because I'm not good enough. Hence the sinner part, okay? Not because mommy is unavailable due to her own limitations. Instead, it gets internalized, and that is what becomes toxic shame. What is the primal injury that begot this emotion, and subsequently, how do I deal with it where it's appropriate? Meaning the right, like not Victoria's Secret, okay? That the primal wound. And then in experiencing that loss, feeling those feelings, which really sucks and really hurts, which is why people have defense structures, coping mechanisms, so on and so forth. The way through that, you feel it, and then after you grieve it, after you explore it, then we can implement
a weight release.
Okay, I'm bored. I'm good.